AIC Kijabe Hospital is a non-profit, faith-based hospital with a staff of over 700, including a number of volunteer physicians and helpers. It's 100 years since we began AIC Kijabe Hospital. Our mission since 1915 has been to serve the poor and the vulnerable in Kenya and the countries around us. And its mission is to provide compassionate healthcare, excellent medical training, and spiritual ministry to the glory of God.
For the past 100 years, Kijabe Hospital has continued to grow and diversify. We provide specialty services in a number of areas, such as obstetrics, gynecology, general surgery, internal medicine, pediatrics, family medicine, orthopedics, pediatric surgery, plastic surgery, ear, nose and throat surgery, pediatric neurosurgery, anesthesia, ophthalmology, and dentistry. We also provide services in HIV/AIDS, radiology, pathology, physiotherapy, and chaplaincy. There's no way we can do what we do without giving everything over to Him every day. And that's one of the key things we've learned. We have so many crises that happen here, so many difficult things that we see, and we have had to learn to trust God.
AIC Kijabe Hospital is renowned as one of the best trained hospitals in East Africa, and Kijabe College of Health Sciences is one of the division of Kijabe Hospital. Currently we have 3 programs. That is the Kenya Registered Community Health Nursing, which goes for 3.5 years. We have another program for Kenya Registered Nurse Anesthesia. The other program that we just started this year is Kenya Registered Perioperative Nursing. The main role of the college is to train and mentor innovative, committed Christian healthcare professionals who would go out there and provide compassionate healthcare in Kenya and the world at large.
So we decided to come out long term. Really, that was something that God really changed our heart. We wanted to commit to something that was going to be hopefully lasting, realizing that, change happens slowly anywhere in the world. We get to train young surgeons from all over Africa. That's exciting to have that kind of impact and be part of that, and to see what God's doing through these folks. Looking at Kijabe Hospital and what Kijabe Hospital has become and what God's done in it over the course of a century now is really impressive, and it's really all to His glory. It's grown a lot. Even in the 3.5 years that I've been here, I've seen it grow immensely, and really, it's really a testimony to God's faithfulness, to His provision, and that we get to be salt and light in the world, but we also get to bring hope and healing to people.
I came to Kijabe just to help out. I'm working as a hospitalist here. Here people are more spiritual. I've never said prayers with my team before we start rounds. That's a daily occurrence here. And it actually is very nice to incorporate the spiritual aspect of health, the mind, body, and soul. It's a whole different experience from what I experienced in the United States. It has made me remember why I went into medicine in the first place. It's remembering the compassion, it's being appreciated, it's being able to help and make a difference.
Faith is the foundation of Kijabe Hospital. The hospital's chaplains are key members of the healthcare team. For instance, they hold chapel services for staff, patients, and volunteers. They also do daily rounds in the wards, visiting with the patients and family members. And they also are involved with the medical team when the medical team does medical outreaches to vulnerable communities, where as the medical team treats, they also share the gospel of Jesus Christ.
Sababu ni Mungu tu amewapatia uwezo wa kuona hiyo ugonjwa na kuitoa ili waokoe maisha yangu. Wakati niliokoka, wakati ule nilikuwa hapa, ile kitu ambayo naweza nikasema ni kumshukuru kushukuru Mungu na kushukuru Kijabe, AIC Kijabe.
Kijabe Hospital was founded in 1915. It was named Theodora Hospital after Theodore Roosevelt and began as a small outpatient healthcare facility for locals. But for the next 65 years, it grew to serve those all across Kenya as it partnered with organizations such as Quon International, Bethany Kids of Africa, and PEPFAR. In 1970, the African Inland Church assumed ownership, and today the hospital is known as AIC Kijabe Hospital. It's been 100 years since the beginning of AIC Kijabe Hospital. I've been here for 7 years, and it's been a pleasure working here and carrying forward the vision of the founders of this place.
Over the last 100 years, Kijabe Hospital has developed into a large teaching and referral hospital. It continues to be a challenge, even meeting the needs that come. Right now, the hospital is in probably its largest expansion phase in its history. There's so many different projects that are ongoing, and the needs are huge. And every day I pray that God will just bring about what He wants to achieve in this place. We have so many dreams, but they may not be His dreams. But we just keep praying that we're doing the right thing in growing our facility. We see people brought to the kingdom, given the opportunity to learn about Jesus Christ.